Hello, everyone. Welcome to Feedstuffs 365. I'm Sarah Muirhead. As we move out of the colder months of the year and the seasonal disease pressure that comes with those months, what does the poultry health landscape look like here at the mid-year? Dr. Eric Shepherd, Associate Director, Poultry Technical Services with Zoetis, joins us to share what his team is seeing in the field and the opportunities to review disease prevention and management strategy. We're going to talk about all those things here today. Welcome, Eric. Thank you for being with us.
Thank you, Sarah, for having me. Look forward to chatting with y'all today. All things chickens.
All things chickens, exactly. So as we reach the midpoint here of the year, what trends are you and your team, what are you observing out there in the field?
Well, honestly, it's a chance for folks in production to take a bit of a step back and a sigh of relief. The common saying is you live one winter at a time. Things are always a little easier as it gets 70 and sunny. Some of the health trends or typical things we see is that people will start to pare back some of their vaccination programs, especially respiratory programs. Is you get better weather, you get more ventilation in houses, challenge tends to go down. So folks will start to dial it back a little bit, try and save a little bit of money, and try and just breathe a sigh of relief here for a little bit.
So what disease challenges, health concerns are currently, would you say, top of mind for poultry veterinarians heading into the second half of the year?
So we still have some periodic LT breaks, laryngotracheitis, which is in years past not really typical. Typically that's a fall, winter, early spring kind of disease, but we still have it in the geographic areas in the U.S. Folks still have some pneumovirus challenges. It's still there. And what we'll see is that people will kind of monitor this as they go along, and they'll see, if it pops up, they'll try and knock it out. And then they'll start to kind of gear up to see what the status is going into the cooler weather.
So you're seeing some, what you'd probably call atypical seasonal patterns on some of these things?
Yeah, LT historically has been a cooler weather disease, fall, winter, very early spring, but we're seeing it sometimes year round in places now, which is very atypical. The old rule of thumb was in between LT breaks, you heat your house 100 degrees, 100 hours. And so you would think, hey, when it's 95 degrees outside, you shouldn't have LT, but we are seeing more and more wild type LT out there as diagnostics have improved and expanded, and we've kind of figured out what's going on out there. So it's something that we unfortunately has kind of become the new normal.
Mm-hmm. So mid-year is often a good checkpoint for operations. What metrics or other factors should decision makers be reviewing to kind of evaluate whether flock health strategies, whether they're working or not? As you say, things change over time.
Yeah, that's a good question, and it's very important. So I mentioned earlier how folks kind of start to dial back, let's say, bronchitis programs for broilers. But if you do that, you have to really be on top of your surveillance. We see folks that make a mistake and they stay on what you would call a bare bones program, if you will, especially for bronchitis. And that wild type challenge starts to build and build and build, and then they kind of get caught late, and then you have issues and grow out in the processing plant. So it's really important as you do this to monitor your surveillance there at, let's say, posting sessions, so that you can see, hey, for instance, 1639, the variant is starting to creep back up. Okay, well, you can stay bare bones, but as it's creeping back up, eventually you're going to have to turn your program back up to a winter mode, if you will. So it's all about trying to stay ahead of that, being proactive versus reactive when, you really get in a ditch.
Right. See it before it gets to be as big of an issue as it might be if you just don't catch it early.
Exactly.
So what would you say are some of the common gaps or missed opportunities that you tend to see when it comes to disease prevention, and what proactive steps can veterinarians take to really strengthen that management and vaccination programming?
I think staying on top of your surveillance, but your routine monitoring, however you do that, and one especially would be bursal disease. we tend to think, hey, it's warm, not going to be much of an issue, but bursal is always there. And if your bursars ain't right, it's hard to make a program work. So in these warmer months, it's really a time where you could utilize a reset strategy, especially something with like an immune complex vaccine. The whole nature of that is to block challenge and try and reduce and dilute it out in the field, if you will. So if you can get ahead of that and really knock down that challenge heading into the time of year when you're going to have a higher challenge, you can really set up your vector vaccine programs, for instance, in the fall and winter to do that much better because the challenge level is lower. So we see folks that the ones that do utilize it, they tend to have much better winters than folks that don't.
Interesting. So then what should veterinarians or managers be paying attention to here as we go to the, we look to the last part of 2026? Are there anything that really should be on their radar screens?
So, now is the time to dot your I's and cross your T's in your vaccination program. So number one is you need to make sure what's in the bottle is getting into the birds. So if you're trying any kind of different application things, or you're messing around with your breeder program, for example, you need to make sure that all that is in tip-top shape so that you are passing along those maternal antibodies you need for these chicks when it's going to be a really tough season for you. And so that involves getting in there, working with your vaccine crews, getting there in the hatchery, watching, mixing, thawing, application with your spray cabinets or with Embrex. These are the really important times to make sure that, what you expect is being done is actually being done, to try and put you on the most solid foundation you can going into winter.
Yeah, winter will be here before we know it, unfortunately.
It's already halfway through the year. And, we have, unfortunately, still consistent high path avian influenza in the U.S.
Mm-hmm.
So just because it's 95 degrees doesn't mean you don't need to be wearing hairnet, boots, coveralls, gloves, foot baths. You have to stay on top of biosecurity. You have to make sure that all this is being done because it's still out there, and pneumovirus is still circulating. So you need to make sure that if you're toying around with your program, hey, we're using a type A or a type B or doing this and that, you need to make sure through surveillance and vaccine monitoring and takes that your program is working like you expect it to.
Any final thoughts or key takeaways to leave our audience with here today?
Yeah, I would say this is the time of year to, hey, take a vacation. Go spend time with your family and kids. They're out of school. Go watch a baseball game. Enjoy the good weather because we know that we're all going to be really busy coming up here in about 4 or 5 months. So monitor your birds, take care of yourself, and enjoy the good weather.
Very good. Dr. Eric Shepherd, thank you for your time today. We appreciate you being with us.
Thank you, Sarah. I really appreciate the opportunity.
Likewise, we appreciate all of you in our audience for joining us. Until next time for Feedstuffs, I'm Sarah Muirhead.